Welcome. The International Federation of Landscape Architects is delighted to welcome you here today to this webinar titled Two Toolboxes, One Common Goal, Promoting Urban Health Using Green Space and Blue Space. My name is Dr. Gail Suter-Brown. I'm the founder and director of Greenstone Design UK and Greenstone Design in New Zealand, salutogenic research and landscape design consultancies. The IFLA World Urban Health Working Programme is a collaborative initiative that aims to enhance health and wellness through nature-based interventions. As the Urban Health Programme's co-director, I hope you will gain some insights here today into the potential of landscape-led interventions, see how research supports action, how academics support practitioners, and how landscape architects are actively collaborating with health professionals to promote health and well-being. Health systems around the world, as we know, are under pressure both physically and financially. In fact, today, Time magazine published an article on the growing mental health epidemic in the US. The article, written by one of the founders of AOL, shared, "We're the first species in history to prioritize pixels over paradise. Think this is an exaggeration? Next time you are at the beach or in a beautiful natural setting, see if people are looking up and focused up and around or focused on the small glass screen in their hands. We've gone from intentional connection to compulsive consumption, from enhancement to entrapment. The health consequences are deeply troubling and should be a clarion call to all of us that change is needed. The good news is that the antidote has been hiding in plain sight and is accessible to us all. Overwhelming evidence shows that just 10 to 20 minutes in nature delivers measurable health benefits." So this is where today comes in. How we get city people outside safely to get that dose of nature requires some design input. And so our panelists are going to share how to create healthy green space and blue space. So firstly, I would like to introduce Jodie Antrobus to you. Jodie is an advanced Health Promotion Officer in the Prevention Strategy Branch of Queensland Health in Australia, with more than 25 years of experience leading the development of statewide public health policy and programs. Her work is predominantly focused on skin cancer prevention, translating evidence into into policy, programs, and place-based interventions that support healthier environments. Jodie is passionate about driving change in the built environment to reduce ultraviolet radiation exposure, particularly through improved shade planning in high-use and long-stay public places. This work is critical in Queensland, which has the highest rate of skin cancer globally. Jodie, please take it away.
Thank you very much for that kind introduction, Gail. Alex is going to just share the screen for us with our presentation today.
Hopefully you can see my screen now.
I think it's just coming up, Alex.
That'll good.
Okay. Well, thank you very much for having us all today. We're here to talk to you about the exciting new UV analysis and shade planning tool that we've developed here in Queensland called CanopyCast Pro. Next, thanks, Alex. But before we begin, I would like to respectfully acknowledge the Aboriginal and Torres Strait Islander peoples and other First Nations cultures across all of the lands from which we're coming from today. And here in Australia, recognising our First Nations people's culture and connection to the lands, waters and communities across Queensland. In Queensland Health, this is really, First Nations people are a very important priority for us. There's very strong evidence that they are disproportionately affected by chronic disease burden and a whole host of other social determinant challenges. So what we can do to improve health outcomes for our First Nations people is a real priority for Queensland Health, and particularly in the branch that I work in, which is focused on prevention work. Thank you, Alex. So today I would like to highlight why Queensland Health is trying to influence for improved shade provision in the public realm. As Gail kind of highlighted before, many of you will know Queensland as the sunshine state, and while we do enjoy an enviable climate and an outdoor lifestyle here, we also have an associated high to extreme UV environment all year round. And in fact, when the UV index is high, the DNA in our skin cells can be damaged in as little as 10 minutes. So these factors, combined with a predominantly Caucasian population whose skin is entirely unsuited to this harsh environment, has resulted in Queensland being the skin cancer capital of the world. And this is one title we're not proud of. The World Health Organization classifies ultraviolet radiation as a group 1 carcinogen, right along there with asbestos and tobacco. So, you know, UV are worst of the worst kind of situation. So a group 1 classification means that there's indisputable evidence that exposure causes the development of cancer, and in UVR's case, the development of skin cancer. Skin cancer is the most commonly diagnosed cancer and the most costly to treat and manage in Australia. Now, you might still be wondering, why is this relevant to me as a landscape architect? Well, because high quality and well-designed shade can reduce UVR exposure by up to 75%. Next, thanks, Alex. Through the Healthy Places, Healthy People framework, Queensland Health has been trying to ensure health outcomes, including shade, are prioritised in built environment policy, planning and infrastructure delivery. Seeking shade is one of the 5 recommended sun protection behaviours, and in many ways the most impactful, as it doesn't actually require people to take deliberate planning or action to protect themselves. If it's available in high standalone use public places and spaces, it significantly reduces ultraviolet radiation exposure risk. Behavioural research also demonstrates that if shade is available, people will actively seek it out. Queensland Health has been trying to influence for shade provision for many years. And along our journey, we actually identified an evidence and policy gap to inform shade tree planning and planting to reduce ultraviolet radiation. So we commissioned some research from our incredible professor here in Queensland, Nathan Downs at the University of Southern Queensland, who is very passionate about understanding UV reduction by trees. And so Nathan undertook some very helpful research for us to help inform tree types, forms, and planting intervals that will most effectively reduce ultraviolet radiation exposure risk. That was very, very helpful, but we very quickly, Nathan and I, realised that neither of us had the expertise to translate this amazing evidence into something that was practical and fit for purpose. So we realised that we would need some translational and transdisciplinary expertise. And we used a co-design approach collaboratively with our wonderful colleagues at Arup to translate this evidence into fit-for-purpose guidance. Next, thanks, Alex. To effectively influence cross-sector policy and planning agendas, I actually found it was very important to determine where the policy drivers for shade were at both a national level here in Australia, as well as state and local government level. were, and to understand which departments across state and local government I needed to work with to get shade firmly on the agenda. So I guess this shade really highlights the main policy drivers that I was able to identify at different levels of government. And, I have been working collaboratively with these departments at state and local government level for some time now. And hopefully we're starting to see some change, which is very encouraging. And I would now like to hand over to my wonderful colleague Alex Brown, who has been the project lead for the development of the Healthy Places, Healthy People Shade Tree Guidance and CanopyCast Pro tool from Arup. Thanks, Alex.
Thank you, Jodie. That was a wonderful introduction. As Jodie mentioned, yes, I'm the project manager for this delightful project for Queensland Health, and I'm just going to step through a little bit of background around the project and the overall application of the great work that we've done collaboratively with Jodie. So preaching to the converted in this room, but I'm just going to give us all a bit of a background around the benefits of urban trees. As Jodie introduced, Queensland Health have a real focus on how tree canopy and built form plays a fundamental role in its contribution to shade within our urban environments and how that really helps to protect communities from the harmful effects of excessive UV radiation and exposure and reduce future skin cancer risk. The illustration on screen really nicely shows those broader health, social, and environmental benefits of tree canopy. And as we know, in addition to all of those benefits, we've got tree canopy really helping to support urban cooling, lowering urban heat island effect, improving ambient temperature, and together with those benefits for physical and mental well-being, the tree canopy really demonstrates the need and for better planning for increasing green space and shaded walkways. So what better way to do that than through an evidence-based approach by utilising the Queensland Health CanopyCast Pro application. And so what is it? Um, it's a free to use application hosted by Arup on the Queensland Health website, and it analyzes UV index reduction and shade provided by built form and tree canopy in urban environments and supports the design of healthier, greener, and cooler neighbourhoods. When you're in the application, you can model trees, built canopy structures, and buildings to understand and observe a project's shade and UV effect at different times of day across any Queensland location. And so Queensland Health came to the landscape architecture team at Arup with the challenge to translate that complex academic research delivered by Professor Nathan Downs. The outcome of that determined the optimal tree species to maximise UV radiation protection and shade provision in Queensland. And so the purpose of this commission, collaboratively with Queensland Health, was to prepare a digital application and develop guidance that can translate that academic research into a practical resource that supports designers, planners of the built environment. So there's importantly three types of evidence that guided the process of the whole project. We embedded open remote sensor data that includes live UV index and weather data capturing climate conditions across Queensland. We extracted the evidence from Professor Nathan's paper, and then we aggregated lots of industry knowledge through stakeholder engagement to understand the different tree forms, types, and materiality of the built and natural shade. So combining all of these inputs resulted in an innovative calculation showing UV index reduction by natural and built shade, and that's informed the application. And then the data output is grounded in evidence and is a new approach to demonstrating the shared benefits of trees and built form. And so, who is our audience? CanopyCast is designed to help inform planners, designers responsible for built and natural shade provision and development. Primarily, our stakeholders are state agency representatives, built environment industry consultants like yourself, and then local government representatives. And all of our stakeholders have a common goal to influence and champion for more trees in the public realm, optimize shade tree outcomes, and have evidence to inform decision making, confirming and validating designs and supporting good outcomes to increase funding for allocation for trees. And so, how can we use it? I've mentioned briefly, but CanopyCast Pro allows designers and planners to assess their sites' existing and proposed shade and UV index reduction by simulating across these four design features that you can see on screen. So you've got natural tree shade, built form, awnings, and shade structures. And then how can we use it? What can we apply it to? We really encourage everyone to test whatever project they're working on in the public realm. These projects can range from active transport corridors, streets, pathways, education facilities, playgrounds, parks, and open spaces, essentially anywhere where, as Jodie was saying, like you've got high use and long stay areas where people are going to need that protection from UV. And next slide. And so how can we use it? So you might start with a sketch or an indicative site similar to what you can see on screen. And you want to start to test that and understand what your existing site is offering in terms of shade and UV index reduction and what your proposed design could lead to. Like you want to understand like how to optimize this. And so I'm just going to step through some of the elements that we'll cover in the tutorial and how we can start to use that. So we can step through how we'll map the existing site and features and street trees, as well as single trees, and then shade sails in play spaces, public realm shade structures, awnings, and built form. And so now that really nicely sets up the tutorial that Natalie's going to run through. I'm just going to stop sharing screen so I can hand over to her.
Thank you.
Thank you, Natalie.
I'll share my screen.
So Natalie is the digital designer that has truly been working hard on creating this application with our software developers, and she is the guru of understanding all the different facets of this web application, and she's going to talk through how we can use it to its best ability.
Thank you. Hi, everyone. So this is our landing page for CanopyCast Pro where you access the application. We also have some handy links down here to our guidance page, which I will go through a little bit later. But this is the projects page that you land on once you log in. For the purposes of tonight, I've set up a project for us here for the IFLA conference. But to create a new project, you would just start up here at the Create New Project button. So you can create multiple designs within one project as well. So for tonight, I will start by actually just uploading an area of interest to get us started because that gives us a really nice baseline to test our existing conditions. There are two pathways to starting your design. You may just create your design, go into the editor and start creating features straight away, or you can upload a file as well, which is what I will do tonight. So I'll just drag this one in. Oh, there we go. So this area of interest that will load up in CanopyCast is a really great way to get started, like I said, just to test our existing conditions. So once an area of interest is uploaded or drawn into CanopyCast, the existing buildings in a radius surrounding the area of interest will be automatically loaded. What you will notice though is existing trees are not loaded in along with existing buildings. So, but you can model these. So, for example, if you knew that there was an existing tree on your site, you can use the editor function over here to create that tree. Choose the tree form and create that one. In a similar way, if you knew that there was an existing building on your site that is not shown in CanopyCast, you can use the building editor to create that building. I'll just pop one over here for demonstrating. You can choose the building base level and building height in the parameters for this one. In a similar way, if you knew that an existing building was being removed as part of your project, for example, this one here, you can select that building and exclude it from your analysis. So I will just quickly save these edits and run the analysis, just so that we can get an idea of what this existing site may look like in terms of shade and UV provision.
Absolutely.
Yeah.
It's a really nice way of like running early scenario testing and starting to understand what your existing site is and saving that off so that you can start to measure against that for evidence of how your design proposal can improve. Should there be low shade provision or high UV index on your site. So really important step to have that initial baseline. Over to you, Natalie.
Yeah, so down where my cursor is now, you can export these analysis results at this stage. That exports as Excel files and GeoJSON files that you can use in GIS software. And that's just a really great way to keep these results for later reporting purposes and for comparing with your design results. So I'll just go back home to our design page. If you would like, you can, there is the option to copy this design and simply keep going on that same design that you were in. But again, for the purposes of tonight, I have created a file to upload. So I'll quickly just upload that one to get us started. Here we go. So as you can see, our site now includes many different design features, including buildings, trees, and shade structures and awnings that we can analyze shade and UV for now. We may wish to add a few more elements to this site though. So I might actually create a new tree line, which you can just use the editor panel over here, select your create new tree line. And I might pop a tree line just over here. Select your tree form and size and spacing as well. And create that one. And I might pop another tree line just here. Create those ones. And I might also put a single tree, so using that create new tree feature, and pop a feature tree on the corner of that street there.
So this is a really nice example of how we can start to plan for different constraints in the built environment. So we can change the sizing of the trees so that they can be more representative of younger tree stock, and then we can also allow for individual trees should there be below ground utilities that we need to design around. So there's that ability to be able to flex and just make sure that we're getting the right outcome in the spaces.
Thanks. Yeah. And just to add a few more features, let's say that this sort of area over here may be a playground. So we may wish to include another shade structure. So if you just select create new shade structure and just simply draw that one in, you can select the height above ground for these ones, as well as the material, which I'll just keep on PVC for tonight and create that one, and that one automatically sort of pops up at the height that you have specified. And I will also just pop an awning onto one of these buildings by selecting that awning feature. This one automatically snaps to any buildings that you already have in your design. So as you can see there, my cursor is just snapping to this building, and I'll just draw it out into our area a little bit more. And again, just selecting the height above ground and material. And there we go. So now that our design is looking good and we are happy with all of the features, using our editor panel over here on the right, we switch over here to the left to do all of our design parameters that we want to use for analysis. So the first one to select is your time range. Now you can just do your whole day, and that will show you results through from 8 till 5 or earlier in the morning as well. But say that for example, if this was an office building and you wanted to really, really know the shade and UV results for the middle of the day, you may wish to select 11 till 1 around lunchtime when workers might be out and about in that area. For tonight, I might just do 8 till 5. You can select your time of year as well. So we have some preset days, including the solstices and the equinox, but you can also just select any day that you would like. So I'll just do summer solstice for tonight. You can also turn off and on your buildings just for that comparison as well. So you can turn off your user created buildings and the existing built form surrounding your site. So once we are happy with all of our parameters, simply save the edits and run the analysis. And here we go. We have our lovely shade results for our site. So our analysis results sort of section pops up just here on the left. You can toggle between the times of day for the results, and also toggle between shade and UV. So for shade, the colors here represent the red is 0 minutes of time in shade for that particular hour that you are looking at. And then the UV results show the UV index experienced within that shade for that particular hour as well. And you can just, flick through the different hours that you've selected up here in your time range.
Nice. And this is a really nice way to start to consider who your users are. So say we had an education facility where we wanted to maximize on shade around the 3 o'clock mark, we would start to see that we've got shade patterns that are venturing into the roadway there. So we might look to modify where we've got tree canopy on the left of the screen, trying to optimize shade across pathways as opposed to in roadways on our projects.
Yeah, perfect. And if I jump back to 1 p.m. for this particular day, this is the hottest time of day at this time of year for our location here in Brisbane. So we can really start to see the difference that our elements make on this site. In areas with no shade, this site is experiencing UV and a UV index up to 12. However, under the shade of these trees, you can really start to extract some really great results and for reporting purposes. For example, under this tree here, we're seeing a UV index of 4. So, that's halving the UV index experienced without shade versus under shade. And of course, our built form is showing some really great results, reducing the UV to 1 or 2 in those areas as well. So really compelling results that you can extract from your analysis. If you, really dig into the results, you can export these results as well in the same format that you had your original results in. So really great for that comparison. So if you would like to, test out your own design in CanopyCast or play around with this particular design, this exact design file is available on our guidance for you to download and upload exactly how I showed you just before. So once you are on the CanopyCast main page, if you just click the tutorials button down here, that will take you to our guidance page. So this includes some really great tutorial videos, which step you through the steps that I just went through as well, and the sample GIS and CAD files for you to download and upload to CanopyCast and have a play around. This also goes through the instructions needed for formatting your GIS and CAD files ready to be uploaded to CanopyCast. So like I said, that the existing trees are not included in CanopyCast. For example, if you had a survey point file for existing trees in your site, you could just follow these steps to format that data set in a way that CanopyCast can read it and upload that one to include your existing trees for that site. This guidance page also includes some really great background information on CanopyCast if you wanted to have a read through that, as well as a resources tab where you can download some communication pack if you'd like, as well as a case studies tab, which we encourage all of our Queensland listeners to please download this template and send back any of your case studies that you have done in the area so that we can upload them to this website. For example, we have this case study in Lowood where we get some really great results from CanopyCast on different projects. So that would be really great to send them through.
Thank you very much, everyone, for listening. And I guess we'll pass over to Simon now. Or is it back to Gail? Maybe
No,
back to
back
Gail.
to me first. Look, that was just fascinating. Thank you so much, Jodie, Alex, and Natalie. Just one question for you. You said that, yes, it's able to be adapted to other places around Queensland. How adaptable is it elsewhere? So, could somebody in another part of Australia use it? Could somebody in New Zealand who also have an extremely high skin cancer rate? What's the potential in terms of other people picking up this tool and adapting it for their own setting?
So at the moment, all of the weather and essentially the evidence that's feeding into the application is all Queensland specific, but the options are endless. Obviously, we would love to roll this out into other states, and it's only as good as the information that you put into it. So, if we could roll it out to other weather stations and get the confirmed tree forms across all of the different states, then we very much would love to expand it further here, Jodie. So, watch this space.
Absolutely.
Fantastic.
And we have had quite a lot of interest from our health colleagues in other jurisdictions for exactly that to happen, Gail. So we're certainly scoping that out, aren't we, Alex?
That's really exciting. And it demonstrates so clearly the strength of landscape architecture to come in and solve real world problems. It's not just a nice to have. This is a real need. Well done. Congratulations, all of you.
Thank
Um,
you.
You.
Did spot a question coming through on the bottom,
yes.
Gail.
Can 3D building files be imported, e.g. through Revit or SketchUp Rhino?
Only ArcGIS and AutoCAD at the moment. So squashing
Right.
it down and then feeding it in as per the instructions on the site at the moment.
Right. Next question. Google Maps, can they be used for the trees and buildings if a survey's not yet available?
It would be up to the user to be like, so they would need to go into GIS or AutoCAD, maybe bring in their own satellite imagery, start to track that, or start to map that, um, like you would if you had a survey file. So essentially creating your own survey file to feed into the application.
Right.
Yeah,
Okay,
just a
question
matter
for
of
you, Jodie.
formatting.
Does your research include practical experiments with tangible results showing how these methods reduce UV radiation?
We've got Jodie, I think
Alex
well,
is probably better placed to answer this one.
I think
You think?
more
Or
broadly,
maybe both of
AILA,
us.
which is the Australian Institute of Landscape Architecture, they are collating a lot of information around well-planted urbanscapes, I guess, in terms of capturing that evidence. At the moment, obviously, this project is very much informing planning, so good outcomes, and we hope that it's used as the baseline for future projects and more trees in the ground.
Fantastic.
Yes, we're
Thanks,
at
Alex.
the early stages, aren't we, Alex?
Yeah.
But
Okay.
that's the joy of a
Trying to
true.
influence our Olympic planning outcomes actually
Ah,
around shade.
there we
So
go.
we're trying hard, aren't we, Alex?
I was going to say that's
Specific.
the joy of a really collaborative approach is that you do get, the real strength from the diversity from the team. Fantastic. All right, Simon, can I introduce you? Simon's the director of the Urban Health Working Programme and Professor of Landscape Architecture at the Estonian University of Life Sciences and Professor of Landscape and Wellbeing. He is also co-director of the Open Space Research Centre at the University of Edinburgh. Simon's going to talk to us tonight about blue space, excuse me. And over to you, Simon.
Right, I should just share my screen and share it and go Control L. Yeah, okay. So, hello everyone, and welcome to this presentation, which is taking us from green space to blue space. And it's a nice link actually, because one of the places that people love to go is the beach. And in Queensland as well, I guess, as most of Australia, there's a lot of beach culture. And that's where we get many of the benefits of nature is with water landscapes or blue spaces, as well as green spaces. And this project was produced by a number of researchers under the European Union's funded Horizon 2020 research programme, which was actually from 2016 to 2020. And of course, we're in 2026 now. But the Blue Health Toolbox, which was developed for that, has proven to be very, very versatile and widely applied, including being some of the tools I'm going to present translated in and produced in a Chinese version, for example, and applied in many different ways for research and for practice. So the project was done through different institutions and many, many researchers. And the one in the middle on the right-hand side of that list, which says Eesti Ülikool, that's the Estonian University of Life Sciences. And that little country on the right-hand side of the screen below Finland and to the east of Sweden is Estonia, just in case some of you don't really know which of the Baltic states it is. What do we mean by blue space, first of all, just to be clear? So it can be natural or it can be man-made. It's an outdoor environment. We're not interested in indoor swimming pools and spas and those kinds of things. Clearly, it's featuring water, but it's not just the water. It's the land as well. It's the interface. It's the edge between the land and the water, the beach and the sea, the riverbank and the river, for example. And it should be accessible to people to getting all of these kind of benefits. So the toolbox itself is a set of research and planning tools, the results of which can be integrated and applied to blue space projects at various different scales, national planning levels, regional planning, local planning and design, and site design. So they enable planners and designers to find out the who, the when, the where, the what, the how questions about a particular site. Who uses it? When do they use it? What do they think about it? And how is a site now? And how do we want to change it and design it? And how would that result produce better health benefits? So we can use it for before and after assessments of a place. So the idea is it's multi-scale. And you can see here, it goes from the country down to the region, the city, the neighborhood, and the site. And some of the tools, and most of them, well, several of them have the B in front, which stands for Blue Health. So some of them are really for the country or the regional scale, getting evidence about which places in a city region, for example, or a complete country are the most popular, and what people do there, down to the site where you'll be working on a design project. And some of them are in between. So we have the BIS, the PPGIS, the BCLS, the BBAT, the BEAT, and the DST, which shouldn't have had a B in front of it, but I don't know why it didn't. So I'm going to run through these and show what they do and how they work. So the idea actually of how to apply them is you can do it over time. So the ideal assessment is you apply these tools at multiple pre and post intervention time points. So you can see the results of your planning and your design interventions. So a pre-intervention phase, you find as a baseline how a place is right now before any project is happening or any plans are implemented. You then do the intervention phase where you're looking at the implementation of an intervention, which might be a large restoration project of a dockland, or it might be something on a reservoir or a new beach. And then the post-intervention is where you look shortly after the completion of the project and then subsequently over periods of months or years to see how that works over a long time. The minimal assessment, if you haven't all of the resources to implement that ideal assessment, is to do a baseline, a pre-intervention baseline, and then you do your activities, you do your interventions, you implement your plans and designs, and then you do a later post-intervention phase to test it and how it works against that original baseline. So the first of these is the Blue Health International Survey, conceived as a way of addressing the lack of coordinated and harmonized data across countries on people's recreational visits to natural environments, in particular blue spaces, and the effects on people's physical and psychological health. And it was done through national level sampling, but planners, if you wished, could use a regional or city level sampling and apply the same protocols if you wanted to contextualize a particular site in the demography of a wider city or region where you are. And you can observe different similar patterns at different spatial scales. So what is the national pattern of how people use blue spaces? How is that varied at a regional or city level, depending on the context of the particular area that you're working? So these are just some examples of data results from Bulgaria, from Sofia in Bulgaria. There were 18 countries which were part of this survey for the project. And in fact, some of the results are only just being published right now, 6 years after we got them. There's so much data. Wait a moment, something's popped up there. So, yeah, so this is about the probability of good health, for example, self-reported, where people answer a questionnaire and say, how is your general health? Is it good? Is it moderate? Is it poor, etc.? And this is related to the residential distance from a particular water body. So showing how probability, the size of the dots, is associated with nearness or further away from the availability of a water body. So that's one way of showing that. Public participation GIS is a method of collecting data about how people use a space, their favorite spaces, what they do in particular spaces, where you ask people to go to a map and identify their places on that map. And this is what's sometimes called soft GIS. because you're collecting soft information as opposed to the hard data of the physical layout, the streets, the buildings, the vegetation of a particular area. So people can go into this and they can implement a questionnaire using a map. And in fact, we didn't develop a system. We took one that's already existing that was developed in Finland called Maptionnaire. And this is what we used. So the PPGIS, if you see this diagram, shows you've got the spatial data layers, the physical world, and so on in different kinds of stuff. And then there's the PPGIS, which is the things that you put on the top of it. So this public participatory is because the data is being collected by the public and applied in that way. And this was developed, and it's called Maptionnaire, meaning map questionnaire. And it was developed by Professor Marketa Kytä in Aalto University in Finland. Here's an example of a project from Plymouth in the UK. So this was called My Blue Plymouth. And we can see the interface there. And then we have the data. So part of the data, the red, is where people live, or more or less where people live, the respondents. Some of them, it seems, live in the sea, and that's because of inaccuracies of zooming in and placing the dots, which sometimes happens. And then we have the data about what people are doing and the places where they're doing it. Some of it is on water, and some of it's on the land, and so on. And then what we can do is we can start doing some cluster analyses, and we can start to see which are the most favorite blue spaces, which are people going to. And you can see here, it works very well. And so we can see that. And that's all associated with data about the people, about their health and well-being, about how they use the space. So here, for example, a visit outcomes saying, for example, strongly disagree is red and strongly agree is green. And so making it feel anxious was strongly disagree, made me feel happy was strongly agree, and so on. The Blue Health Community Level Survey is a concise version of the Blue Health International Survey using similar questions, but ideally for community level, for a neighborhood, really, or a district in a city. So you've got flexibility for the questions, and the questions were adapted and brought in from different validated surveys. So it was a kind of building block of different survey questions were brought in that we know work and give you the right answers and are worded in the correct way. But flexibility so that you can sort it out and tailor it to the context that you are working in. And you can administer it in different ways. You can do it online, you can do it by paper, you can door knock people, you can go out in the park and ask them and that kind of thing. So what it does is it queries people general and more recent visits, for example, in the last 4 weeks. So you're getting more recent stuff and you ask about the site quality, how they view it, the date, the duration, activities, who was there, and the visit outcomes like satisfaction, nature connectedness, perceptions of safety, litter, facilities, things like that. And you get demographic details. Dog ownership is a really important factor, garden access, household composition, marital status, all those kind of things. So this is one of the project's interventions. I'll be briefly coming back to that later. It was a small outdoor theatre that was put in a rundown park in Plymouth, where there's actually social deprivation right on the edge between the tidal zone of the water and this little park. And this was the area that was subject to most of the different survey before and after as an experimental intervention. And this shows different well-being and life satisfaction before to after the intervention. So, and we can see from this the kind of changes that came out of that in terms of site quality. So all of these bars are the increase in in positive aspect post-intervention. So, for example, the well-being life satisfaction went up a certain amount. Positive well-being went up a lot. Site quality went up a lot. Nature connectedness went up quite a bit, and so on. So we can see the way that the intervention had a positive impact. The Blue Health Behaviour Assessment Tool, or BBAT, is to get an idea of who does what, where, and when on a particular site. And this is using what we call behaviour observation, which is a tool or a method that was developing quite a lot, but it was done on paper. It was really complicated to get the data. It was very messy. It had lots of scribbles and symbols, and you couldn't really do a lot on it. So we developed a GIS-based recording application on a tablet computer on site, where all the data is automatically linked to a database. You've got the site, and you record who is doing what, where, when, with whom, primary and secondary activities and such like. And it's built on top of the Quantum GIS or QGIS GIS program, which is free open source software. And you can download some additional scripting, which you insert into this, and then you can use it. And you can also set up and tailor activities might be specific to the site in question. So here's a project site. This is in Plymouth. This is the one where we built this small theatre, which is where that red dot is on the right-hand one. So this is the before and after. So 2017 before we did the intervention, and 2018 in the summer afterwards. And we did the same observations from June to September on exactly the same days and times in both years to see what the difference of the impact was. So this was it before the intervention on the left and after the intervention on the right. We got rid of cars, we created and improved the access to the water, and so on. And this was the totality of the observations seen in both years. You can see very big clusters of dots along the main path running through the site. That was actually where people are going to and from work, and car parks and things like this. And then there's the old slip road, and then there's the location number 4, where the little theatre is. And what we found actually was that the number of observations, not the number of people, but the number of observations, this slightly different thing, more or less doubled between 2017 and 2018. And you can see a big cluster down by our intervention and along the edge of the cliff and on the beach and so on. Now, this is about the different activities. So you can color code those dots because you've got lots of attributes to those dots, who they are, what they're doing, and you also have it associated with weather and time of day and that kind of thing. And then you can, in the database, the attribute table, you can determine different symbols for different activities, like red for sitting, and a blue triangle for standing, and a circle for an open circle for outdoor play, this kind of thing. And you can see the amount of use and the pattern of use shifted quite significantly with a focus on the edge and down on the beach and on our little intervention. So we could see what the difference was before and after. And then you can do things like a heat map or a hotspot analysis to see the patterns and clusters and that sort of thing, like you've got the before and after there. And you can also do statistical analysis using the different data that you've got from the database, non-spatial data. So we can see the number of activities by gender, for example, where there was an increase in use of the place by women, particularly, not so much by men, but very much more by women. And also you can look at the probabilities of the distribution of activities, again, before and after. The next tool is the Blue Health Environmental Assessment tool. So while we've looked at what people are telling us through the questionnaire surveys and what people are doing on the site by the observations, we can also assess the site itself through looking at different domains related to blue spaces. And each domain has different aspects. So we can look at how the blue space is before, as it is now, the condition, the quality, the safety, the accessibility, things like that. And then you can do your design following and making sure that you are addressing the issues that you identified, the problems that came up from that first assessment, and maximizing the strengths and good qualities that were already there. And then you can look at it afterwards to see how the design managed to improve the space. So it covers two linked assessments, one of the terrestrial part of the blue space, the land, and one for the aquatic part, whether that's a river, a canal, a lake, or the sea. And you go through it in a different set of steps. And it can be also a community version, which is simpler, and a professional version. So you have these different steps: desk survey, where you collect lots of data that's existing about the site and its surroundings in GIS and so on. Your first impressions of the site, they always count. Then a detailed assessment based on a set of domains. And then there's the aquatic assessment, which is following a different model. And there's an interface on the website where you can download forms and you can fill in data online, and then you can get a report out of it. And so you work your way through these different sets of questions. That's for the step 1. Step 2, you write in about your first impressions. And step 3, you've got different kinds of things that you collect. This is just a few of the long list of things that you can collect about the site. And here's an example of 3 of these different types of sites: one in Tartu, of standing water, one in Spain, running water, and one in Plymouth, the marine environment. And you've got these different domains: access and circulation, condition, visual appearance, functionality. And you're using these scores of 1 to 5 to rate the quality. And that means you've got comparative images of these spidergrams to show you different sites and different kinds of places, and also you can do it for the before and after to see what the difference has been. So that's one example of physical domain. There are other domains, I just haven't time to show them. And then finally, the decision support tool is all about on-site assessment and decision-making for optimal design, particularly looking at risks and benefits. And so clearly one of the risks is UV exposure, and that is built into the tool. There are many benefits, of course, and risks of social and mental and physical health benefits, and also benefits to the environment by good design to minimize the pressures on the riverbank or on the water of pollution. But the risks are from drowning, from UV radiation, from waterborne diseases, from attacks by sharks in Australia, and those kinds of things. And so you then go through this tool to identify and get an assessment of the main kind of risks and benefits you're likely to find in that particular location. And so you have these different domains here. One is protecting human health, injuries, illnesses, extremes. And you can see in the climate extremes, it's temperature, it's UV, and it's flooding. There's vectors like mosquitoes and malaria. And then there's the promotion and the positive part, the benefits, which is mental health, physical health, and ecosystem health. And so these are just the structure of this. And there's an interface, and you can go in, and it explains the way you use it. And I don't have any more time to go through and demonstrate it. But all of these are available from the main Blue Health website. Here's the link there, and the special Blue Health Tools website for the BEAT and the BBAT can be found there. And all are explained in the book, Urban Blue Spaces, Planning and Design for Water Health and Wellbeing, which is open access from Routledge, so everybody can get a hold of that. And you can find all of the tools are described, demonstrated, presented in the book, illustrated, and linked with all of these websites, which are still up and active and will remain so. And I will just mention, because we have a big Chinese audience, that they've already been translated. The beet is translated into Chinese, and the book has been translated, and it's going to be out in July. So
Fantastic.
we're also spreading this outside. So
Simon, one quick question for you. Thank you so much for that. From the research where it was applied, was there one particular type of blue space that was most effectively reported as being good for health and well-being?
Well, that's a good question, actually. I'd have to dig into some of the results from some of the papers.
But nothing that
to
came
see.
from
No,
top
not
of the
really.
head.
I think all blue
Just
space
blue
is
space is
really,
good.
yeah, blue space is good. Yeah. I mean,
Excellent.
it depends what blue spaces you have. You know,
Yeah.
an island nation has lots of coastline. A landlocked nation has a river, maybe, or
Sure.
or some
And
lakes.
as
You
we
know,
know,
so
not all green space is created equally in terms of its health promotion effect. So if blue space, you're saying, is more universal, perhaps we need to emphasize our blue space in our urban centres. Thank you, everybody, so much for your time tonight, for presenting. Jodie, Alex, Natalie, and Simon. It's been a wonderful session. Thank you to everybody for joining us. Please join us again for our next Urban Health seminar, which will be promoted and coming up in a couple of months' time. So once again, thank you and have a great day.
Thank
yes,
you.
thanks everybody.
Thank
Bye-bye.
you.
Bye now.